William has been in to see me on a number of occasions to discuss his anxiety and his cannabis misuse.
I find that the weed is the only thing that keeps me sane.
When I saw him last, we discussed ways forwards for this to reduce down the cannabis misuse and to try and increase his self-esteem with a long-term view to returning to the workplace.
I really felt bad coming today, not asking not doing what you asked me to do, and I just thought, well, God, if I can't do what the doctors asked me to do, and the job centre are literally might as well be talking to a brick wall.
How are you today?
Yeah, I'm okay. I've been better, but I've been worse. So
okay.
I feel like a better person, like less stressed, like more energy. I'm not thinking about the weed as much. It would be nice if I could cut down and knock it on the head completely to the point where, you know, I don't think about it, but I don't ever envisage it. I don't, not anytime soon.
Okay. And have you what's happening at the moment, any thoughts regarding work?
I mean, I'm still at that, I say crossroads, it's not really a crossroads. I feel like I'm just at that precipice with like no real skills that I can translate into the workplace. I mean, I've had some good jobs like many years ago, like another life ago really, and the gap in my CV is just so like huge. Yeah. That like I don't get the callbacks or anything.
So it's 10 years without work.
It's like 10 years without work. I mean, obviously I've done like a day here, a couple of days here, helped out and done a bit of voluntary work as well, but I feel like I'm going backwards.
How are we going to get things going forwards?
Obviously, I don't want to be on the sick. I don't want to be a benefit, like seen as benefit scum.
At the moment, you're 33 and not worked for 10 years. And
I know, it's shocking.
The chances of returning to work are
dwindling as we speak. I know.
We want you to become productive again, and you know.
I had big dreams. That, like, this is what my first couple of counsellors was saying. Like, you built yourself up too high.
So the only counselling that we would have access to is through WCDAS or IDAS or whatever we're calling them.
It's literally that's my only option from counselling. Is through the drug angle. See, I'd rather talk to a wall than talk to someone like condescending with their.
Yeah. And you've said before.
I mean, what you said to me? What's the alternative? Go and have a drink? Like, no thanks. Yeah, I'd rather die.
You've said before with the from the cannabis point of view, you use it to kind of treat anxieties and so forth. What happens if we tried another medication? A medication from an anxiety point of view. Have you been on anything antidepressant, anti-anxiety?
I was on antidepressants for about 3 months, and it was the worst 3 months of my life. Like, you know
which medication that was?
I think it was fluoxetine.
Fluoxetine. What happens if we tried something, perhaps a similar sort of medication called sertraline, and we gave it a try? Should we do that?
Yeah.
Okay.
So I'm open to suggestions because it's literally I've been on this path for like 10, 12 years, bouncing along like just blowing in the wind, literally. And
well, let's have a go because it might help to control the anxiety, and then that may well mean that you're smoking less cannabis. When we start people on these medications, we do like to review them early, so in 2 weeks' time.
Okay.
And so I'll do the sick note for 2 weeks.
Okay.
And then bring you back. That goes through to the 13th. Brilliant. Okay.
Thank you very much.
I'll see you in a couple of weeks' time.
Thank you.
Okay, take care. And you.
Come in, take a seat.
I'm like an idiot, because I've just been swimming and I've gone completely deaf.
Oh, no.
Well, not completely, but I've got one question while I'm here. I was sorting through my pill drawer, found this packet, which is only February, and I've no idea what they're for. I hope it's not something I should be taking.
I'll tell you. That's one I don't actually know.
I can't say it, that's for sure.
So nausea and vertigo?
Oh, I know what it is. I had a very strange giddy turn.
Yeah, there you go.
And my neighbours all thought I was having a stroke.
Oh,
I was talking strangely. And
did it just suddenly come on?
Yeah, and I was trying to use my mobile to ring somebody and I couldn't sort of coordinate properly. Oh, I can't look at that.
And it was nausea and...
I'm just trying to think of the name of it. Gone from me as well.
Was it about your ears? Was it to do with your ears, the balance?
I think so, yes.
Labyrinthitis?
Yes, that's it. It was very frightening because when I couldn't use the phone and I was feeling unsteady and I'd thrown up all over my flat But I got to the front door and the dustmen were just there. And they were wonderful.
Oh.
They went down the road and got my friend for me.
Did it feel like you were on a boat?
Yeah.
That's the imbalance of the ears.
Yeah. And I wasn't speaking clear. Oh, God, that's all the signs for a stroke.
And of course, once you start to worry,
Yes.
that makes everything worse, doesn't it? But it's natural to worry. There you go.
Lovely.
All done.
Thank you very much.
Pleasure.
Now I'm killing time. I've heard yesterday that I've got an appointment at George's this afternoon.
Oh,
So I've
okay.
got an appointment at the skin clinic. So.
Are you getting around this
Yes,
week?
absolutely.
Nice to see you, always.
All the bits are being checked.
Take care. Bye-bye.
Basically, I have been having like pain in one of my breasts,
Right.
and I wasn't sure what it could be, basically. I'm probably like a little bit oversensitive anyway because my mum had breast cancer about 3 years ago, so it's something I kind of keep an eye out for.
What's happening with the pain?
It's not really, it's kind of just like a bit of an ache, and it feels like more like bruising.
Okay, and how long has it been there for?
About 3 weeks.
Okay.
It was kind of straight after my period and has carried on.
Okay, and are you on oral contraceptive or not? No.
No.
Okay. I wouldn't think much more of it at the moment
Okay.
in someone that is your age, in
Yeah.
24.
I was just really worried, I think, just because of
What
kind
happened?
of everything.
Yeah, understandable.
But I just
What
thought
age
so.
was she?
She's actually had cancer twice. So she
On the
had,
breast twice? Or
no, she had a lymphoma when she was about 26.
God.
And then breast cancer recently, and she's about 47, I think.
Okay.
So, because it's kind of a pattern with her, like I recently have been, the last couple of years have been kind of a bit more.
And is there anyone else in the family that's had breast cancer?
Yes, one of my great aunts on my mum's side. So she got diagnosed shortly after my mum did. So,
okay.
yeah.
But she's a great aunt.
So she's my mum's aunt.
The mum's aunt.
Yeah.
Okay, yes, yeah, okay. So I always think it's quite a useful form. This is from Oxford University with their for their cancer genetics referrals. So if your mum had been diagnosed below the age of 40, one close relative, then we would be at that point we would be saying, well, actually maybe we'll do some genetic testing. And there's a couple of genes like the BRCA gene which are closely related to that. And often then you see if there's someone's got a BRCA gene, probably there tends to be several people that have had problems. So it might be somebody that presents very young, but there could also be two close relatives with breast cancer under the age of 60. So we're not sort of approaching any of these criteria. So we're not really thinking about increased risk. So I think that's hopefully quite a reassuring thing to
that
think
is
about.
very reassuring. Yeah.
I think in general practice over the last few years, we've certainly seen a difference in the numbers of people presenting with very vague symptoms who are very concerned about significant underlying causes for this. There's so much coverage in the media of missed cancers and so much concern that any symptom could well be cancer. If you ended up with this sort of breast pain that was ongoing and it was coming from the breast tissue, then we would refer to a breast clinic at that point.
Okay, so just keep an eye on it, basically.
I really would, yeah.
Okay, cool.
The real challenge in general practice is trying to identify the patients where those symptoms are important and we should be investigating them further. So yeah, I wouldn't worry too much about that and then I'll just see how things go.
Yeah, okay, brilliant.
Okay.
Great, thank you very much.
No worries, take care. Have a good afternoon.
Thanks, you too.
Bye then.